Late afternoon, everyone, and welcome to the U.S. Center. This is the 5th U.S. Center we've had at the COP, so we're happy to be back again and happy to see some of the same faces in the audience that we've seen other years. My name is JENNA JADIN. I'm a climate change specialist for the U.S. Agency for International Development, and I've been the MC here this week. If you haven't been to the U.S. Center before, you should know that it's a public diplomacy effort that's put on by the U.S. Department of State, in which we highlight activities that the U.S. is engaged in both domestically and abroad that are aimed at combating and understanding climate change. We've had a really busy schedule all week. We're going to have a really busy schedule next week too, so we hope you stop by and check us out again. Our event right now is titled Health Adaptation in the U.S. and Around the World. We have several speakers, but I will just introduce the moderator of the event, who's Dr. John Balbus, Senior Advisor to the Director of the National Institute of Environmental Health Science for Public Health Issues. He also helps lead efforts on climate change and human health for the National Institutes of Health, represents the institutes in the U.S. Global Change Research Program, and is the co-chair of the Interagency Cross-Cutting Group on Climate Change and Human Health. So, John, you can go ahead.
Thank you very much, Jen, and good afternoon, everybody here, and good day to all of you tuning in wherever you may be around the world. It's really a pleasure to be able to bring to you this discussion about health adaptation for climate change in the United States and around the world. I want to thank the U.S. Center for hosting us today and for allowing us to web stream this so that many people around the world can be watching today. I'm expecting that in the audience we have some people who are very familiar with the world of the health implications of climate change and some people who are less familiar with that world. So I'm hoping that our discussion today will speak to all audiences and give those of you less familiar with the health implications some basic introduction to what those implications are and how we're dealing with them. But in turn, those of you who are very much part of this world, it will give you an idea of how the efforts for health adaptation are progressing, both on a regional basis and on a global basis. So our goals for today are to try to identify what's going on, and I have wonderful experts who I'll introduce in a second, but they'll be talking about what's going on in their regions, and then we hope to have an open discussion about the kind of challenges each of us are facing, the challenges those of you around the world doing health adaptation work are facing, and how people are starting to address those challenges. Our speakers today, and I'll introduce them now, and then they'll have a chance to speak about their programs in just a couple of minutes. Here in Warsaw, we have Dr. Magaran Bagayoko, who is a senior advisor on environmental health and on climate change issues at the World Health Organization's regional office in Africa. We also have Dr. Diarmid Campbell-Lendrum, who's the team leader for climate change and health at WHO headquarters in Geneva. And then joining us remotely, we're very fortunate to have Dr. Carlos Corvalan, who's joining us from Brazil. He's the Senior Advisor for Risk Assessment and Global Environmental Health for the Pan-American Health Organization, the Americas Regional Office of the World Health Organization. And also we have Dr. Jan Semenza, who is the head of the Health Determinants Program for the European Centers for Disease Control and Prevention. And so each of those speakers will be able to give us their perspectives on a regional and on a global basis. I just wanted to introduce my institution a little bit. For those of you not familiar with the National Institute of Environmental Health Sciences, it's part of the National Institutes of Health of the United States, but it's a very different part in that it's focused primarily on environmental exposures and the prevention of disease. We have a whole institute down in North Carolina that's dedicated to gaining a better understanding of how the environment affects health and how to protect people's health by reducing environmental exposures. I also wanted to just introduce, I'm also speaking, wearing the hat of, as being a co-chair of a working group that we have in the U.S. government that is focused on climate change and human health. It's part of the United States Global Change Research Program, and it's kind of a pilot within the Global Change Research Program to help take our federal research program and get it to make the bridge between basic science research and interventions in the real world, and in this case it would be public health practice. So I'm joined by co-chairs from our Center's Disease Control and Prevention and also from our climate agency, the National Oceanographic and Atmospheric Administration. And you can see there a list of a lot of different agencies who all bring their expertise and their programs to these efforts. So the health implications of climate change have been recognized by leaders in the global health world as being among the most profound and important threats to human health over this next century. And this is a quote from Dr. Margaret Chan, the Director General of the World Health Organization. It's actually a quote from 2007. And she's saying, that we need to be able to convince the rest of the world that humanity is really one of the most important species that's endangered by climate change. And part of the theme for today is that that quote 6 years ago really was a call for action, and in some ways action in the health sector, the development of adaptation programs, adaptation knowledge, has lagged behind some of the other sectors if you look at adaptation efforts. And so part of what we want to do today is to discuss what have been the challenges in getting things going, but also to present the early stages that we're in and some of the positive things that are going on. There are many different kinds of ways that climate change impacts health, and I just wanted to review very briefly that what some of those ways are, and I'm discussing this and categorizing it by the different types of ways that climate change impacts health, because each of those ways would demand a different type of adaptation effort. It may be a different sector that's involved, it may be a different kind of scientific information that may be involved. So the first category would be those kinds of health impacts of climate change that are really the direct result of weather phenomena, whether those be unusual heat waves or extreme events like floods, devastating storms like we're seeing right now, the impact of devastating storms in the Philippines. Some of these impacts of heat are easily recognizable as being heat impacts, so heat stroke or heat illness is clearly related to heat, but we're also learning that heat stress plays a very significant role in increasing mortality in people with a lot of different chronic diseases, ranging from cardiovascular disease, diabetes, or some kind of chronic respiratory disease. So those are all different ways that heat impacts people. There's also ways that climate change acts by having atmospheric processes or land processes that actually change the physical or chemical environment that we live in. So some of this may be related to greenhouse gases making ozone depletion worse and increasing the levels of ultraviolet radiation that penetrate to the Earth's surface. Or we also know that warmer temperatures and different atmospheric conditions can either increase or decrease air pollution levels and alter the effects that that air pollution then has on human health. We also see that happening, well, that's a biological agent. So the third category would be the impacts of climate change on biological agents. That could range from what I was about to say, which is that changing timing of the seasons, earlier springs, later winters, leads to longer pollen seasons, and also carbon dioxide directly increases pollen levels, so there's an impact of climate change on those with allergic diseases and asthma, but also a wide range of impacts on bacteria, on viruses, on insect vectors, on animals, altering the systems by which humans can get diseases and infections by them in sometimes simple, sometimes very complex ways. And then lastly, the fourth category is the impact of climate change and sea level rise on the essentials of life. And this is something that we're seeing right now in very low-lying island states where we have salination of water supplies, problems with land and salination of land, and just loss of habitat in general. This is something that is not being seen everywhere now, but is very much a problem in certain most vulnerable states around the world. So with that as just a very brief background, I just wanted to describe some of the things that are going on in the United States. On June 25th, President Obama announced a new climate action plan, and that climate action plan has three components. One dealing with the reduction of greenhouse gas emissions in the United States, one dealing with the United States providing more leadership on the international front, and then the third area is improving the resilience and climate resilience of the United States, an adaptation call to action, if you will. And within that adaptation plan, health is featured in several ways, and I just wanted to describe those briefly. So the first is a new initiative that we're embarking on to increase the sustainability and climate resilience within the healthcare sector. So working with hospitals and all kinds of healthcare facilities to improve their resilience to extreme weather events primarily and extreme climate events. The other piece of this is a community health resilience activity. This is being done by the Centers for Disease Control and Prevention. It's primarily built on their Climate Ready Cities and States initiative, and I'll just tell you a little bit more about that. This is a program that's providing funding to 16 different states and 2 cities, and each of those entities is doing its own, if you will, its own version of a national adaptation plan. So each of those has to do a vulnerability assessment to collect the data, collect the health data and the climate data relevant to their locality, assess the vulnerability and come up with their own adaptation plan and then evaluate it. And that whole process is being done through a framework being developed by the CDC called the BRACE framework. It's this 5-step framework that has those steps that I just mentioned, bringing in climate forecasts, looking at the underlying health status, assessing the interactions between climate and health, developing and implementing adaptation programs, and then assuring that you come back and evaluate the effectiveness. There are a couple of other elements of the President's Climate Action Plan that aren't as explicitly called out, but are activities that we're doing. This is a screenshot of a web resource that we've built within our interagency group. It's called the Metadata Access Tool for Climate and Health, or MATCH. And this is a place where primarily researchers in health or public health practitioners can go and find out about data sets that the federal government collects that are relevant to understanding climate change and health, ranging from temperature and precipitation data sets to the monitoring of vectors and monitoring of other kinds of disease transmission agents, all the way through to our data sets on health outcomes. And you can almost see the URL at the bottom. It's match.globalchange.gov. And then just most recently, I just wanted to highlight an executive order that came out earlier this month that provides some instructions to the federal agencies to, again, to highlight and step up their efforts at an agency level on climate resilience. And so some of the instructions in this new executive order, and there will be more discussion of the President's Climate Action Plan, and I'm sure this executive order next week in a broader sense, but just from a health standpoint, there are calls for the agencies to remove barriers and disincentives to effective adaptation, effective resilient investments. There's an effort to improve access to data and tools, similar to the MATCH site that I just described, to provide more information to people so they can make informed decisions, to work at the agency level on climate adaptation plans, and also there is a creation of a new climate preparedness council that will bring together state, local, tribal, private sector leaders with the federal government to try to improve our solutions. So with that, I'm going to stop and come back to my chair, and we'll be able to hear from each of our speakers about the adaptation programs going on in their region, and then we'll start a more general discussion. I'm hoping that this will be informal, and when we get to the discussion part, that we'll be able to get questions from members of the audience and have some two-way dialogue. But first, I want everybody to hear about the programs in the various parts of the world. So our first speaker is Dr. Bagayoko.
Good afternoon, and I would like to really convey my gratitude to John and the American Center for inviting WHO, particularly the regional office, to talk about Africa. Today, I'm not going to talk about Africa is the continent of power. We have a lot of problems, but what I would like to say today is Africa is part of the solution. So, and all the disease burden that has been described by John has been also described in Africa. So we have this concern, we have these challenges, we have these issues, but now we have taken step, and I will go through what Africa has taken as step to address climate change, particularly in relation to public health. So I will start by the Libreville Declaration, and for those who may not know this declaration, in 2008, knowing that addressing health and environment needs a concerted effort, African ministers of health and African ministers of environment got together in Libreville and signed a statement called Libreville Declaration. And the most important point in this declaration is to build a strategic alliance between health and environment. So they agree upon also number of action points, including knowledge management, including joint planning, and also including allocating more financial budget resources. So this is the common umbrella. And 2 years later, the same African ministers joined their efforts and meet in Luanda and agree on what we called the Luanda Commitment. So the Luanda Commitment basically aims to boost the implementation of the Libreville Declaration. And there they agreed on the top 10 priorities for Africa, which include, of course, basic environmental issues like hygiene, sanitation, and also that include also climate change as a priority. So WHO contributed to support the work of the UNFCCC. So the starting point was to review the health consideration in national adaptation plans, in NAPAs. So we reviewed 41 NAPAs, including 29 in Africa, and we realized that in most of the NAPAs, health has been cited, but health component is very weak. There are a lot of gaps, and the intervention proposed are not really adequate to face the current challenges. And the main reason for that was that there was not an integration and a participatory mechanism in the region level. So having said this background, it is against that in WHO, we developed what we called the African Program for Climate Change Adaptation to Climate Change, which is a continental program. The aim of this program is to contribute to mitigate the negative impact or to address the negative impact on climate change on human health. So this program is articulated around a set of objectives. The first one is to yield more evidence, meaning to really develop what we called to undertake a comprehensive assessment of the risk and assessment of the capacity, the management system in place at the country level. So the second objective was to build in these countries an integrated health and environment surveillance system. So because in most of the countries you go, they have a huge data, let's say, on cholera, but in the same database, they don't have the data on the quality of drinking water, which is really an issue. So we wanted now, instead of monitoring these parameters in a fragmented manner, so to do it in an integrated manner. So that is the second objective. And also in the same, we proposed a package of public health interventions that include food security and food safety, that includes vector management of vector-borne diseases, that include chemical management. So, and finally, the research, operational research, because we need more evidence. And now, once the plans have been developed, what has been achieved so far? So we did that in a very short period, but so far, at the country level, we did what we called situation analysis and need assessment SANA for the implementation of Libreville Declaration. So this is the assessment of the environmental risk factors and their management systems. That has been done so far in 34 countries. After that, we supported currently, and the last session was in September, 43 African countries to draft their national adaptation plan. So this is really an output, and now these countries are working and finalizing this. At the regional level, so after developing the work plan, we took a step and we go and now built a sort of consortium called Clean Health Africa. So Clean Health Africa includes all of the key research institutions in Africa. So it includes research institutions you may know, KEMRI in Kenya, OSEAC in Central Africa, the MRC in South Africa, MRTC in Mali, the University Sheikh Anta Diop, AGMAD, and all these relevant institutions. So we had our very successful first meeting, and we agreed on a first year work plan. We are working on it. So, in fact, we are really moving ahead. But the key challenge is now integration at country level. So, and we think really that building a strategic alliance between health and environment is the way forward. So, and I will stop here. This is how far we are addressing climate change and health. Thank you.
Thank you very much, Dr. Bagayoko.
Okay.
And yeah, please come back here. And now we will be joined remotely by Dr. Carlos Corvalan, who is with the Pan American Health Organization in Brazil. And greetings, Carlos. Thank you. We have a wonderful audience here waiting to hear about regional health adaptation efforts in the Latin America region.
Very briefly, I know that I only have 3 minutes. I want to be very briefly, but I wanted just to give you a context of how in PAHO, first of all, PAHO is, as you know, the Pan American Health Organization, and it's the regional office of WHO in the Americas. And we have followed a similar process to other regions. We have had our ministerial conferences, and what is important for us, really what gives us a very important mandate, is that in 2011, the directing council of the organization, that means the ministers basically, agreed on a platform for work. Now, remembering that the first WHO report on climate change and health came out in 1990, we're talking about over 2 decades. But obviously, we have not been idle all this time. But what we have now, which is different from before, is a very strong political commitment from the countries. So I just wanted to show you, this is the basis of the strategy. But in the next one, I can explain it better. If you have the next slide for me. Yes. These are the 4 areas of this strategy. And what I really want you to observe is that in the 4 areas, evidence, awareness raising, the partnerships, or the adaptation, in all of them, we're looking at to interventions. So under evidence, you see items like facilitating the evidence-based actions to reduce health risks associated to climate change, or under raising awareness, we want to increase the knowledge of the effect of climate change on health in order to facilitate public health interventions. Similarly, in partnerships, and similar to our colleagues in Africa, we do work very much with other ministries, agriculture, environment, etc. We want to promote policies and interventions between countries in coordination with all other agencies and sector. And I have highlighted there the adaptation because this is the key issue and also the subject of this discussion, which is to support the evaluation of the population vulnerability to climate change and identify adaptation interventions. If you go quickly to the next one, what I wanted to show you there and give you a link to this report, which is called Protecting Health from Climate Change. This was done by all of WHO. We had a meeting in Costa Rica with all WHO region and headquarters. We had over 20 countries contributing with their ideas and information. And what is most important is that this is a very simple and flexible tool. We're not talking about things that need experts to do, but things that can be done by with little preparation by people at local level. What we managed to do, interesting for us here, is that in this strategy approved by the ministers, we managed to put an indicator that you can read there. It says, number of countries that have completed climate change and health vulnerability and adaptation assessments. So we're able to go back to the countries and say, well, tell us how we can help you so that you can achieve this indicator. So I can stop here now and we can discuss more later.
And we will look forward to hearing more from you in just a few minutes. But now we're going to go to another speaker who is located remotely. We have, I want to recognize that we have one of the WHO regions who we didn't have time to put on the agenda, but Dr. Bettina Meni is here from WHO Europe, and we'll hopefully hear from her as well. WHO Europe is also heavily engaged in health adaptation efforts for climate change. But I've brought in another representative from the European region who is doing a slightly different kind of set of projects, Dr. Jan Semenza from the European Centers for Disease Control and Prevention. And we've lost contact with Dr. Semenza. Okay, so why don't we then go to Dr. Diarmid Campbell-Lendrum, who will give a global perspective, and then we can open this up to some more conversation.
Thanks very much. Can I
use the mic?
Thanks very much, John, and thanks very much for inviting all of us here to speak at this very important event. I will also try and be brief. I can be very brief in giving an overview of what our job is in relation to health adaptation to climate change, and it's basically to back up the countries and to support the regional offices. Obviously, the work that needs to be done on health adaptation to climate change needs to be owned by the countries and driven by the countries. And we as a member state organization, as WHO, all that we do is to try and facilitate that process, as you will have heard from the previous presentations. But from a global perspective, the ways in which we do this, I think Carlos's comment was very relevant, which is that WHO has been publishing reports on climate change and health for over 20 years now. The comment was made, I think, by John early on, that health is sometimes considered to be, or sometimes we consider ourselves as behind other sectors in reacting to climate change. And I think it is and it isn't true that that's the case. We've been talking about it for a very long time. But I sometimes think of the health sector as, I'm not sure this is the right metaphor in a climate change conference, but like an oil tanker. It takes a long time to turn it around. It's a big, important piece of machinery. It's a big, important part of the economy. But on the other hand, when you can get the health sector engaged, it can make an awful lot of difference. And one of the things that has really helped us to get engaged were the speech that our Director General gave in 2007 at the NIH in the US, which was then backed up by a World Health Assembly resolution. So all member states of WHO, basically all nations of the world, said that climate change was a real priority for global health. And on the back of that, basically gave WHO its orders in terms of what we're supposed to do to support countries to protect health from climate change. And that is on leadership, on partnerships with other parts of the UN organization. It's advocacy, making clear that as our Director General said, that human beings are the most important species to protect from climate change. A lot on evidence, because we're a technical organization. But the main emphasis that we are pushed from our member states is on making health systems resilient to climate change, and the examples, very good examples from the US are excellent sort of testament to that interest in just strengthening health systems to make them robust to climate change risks. And so in terms of what has happened in the last few years, John also asked us to think a little bit about what works, what has worked and what hasn't worked. I think in recent years, we have had a very rapid increase in the amount of work that is going on health adaptation to climate change. We have, partly through our support and donor support, we have several representatives of ministries of health, particularly from African countries, in the room here, so participating in the negotiations. And one of the things I think we have been good at from the health sector in recent years is I think we're quite systematic in our approach. And so when the UNFCCC Secretariat says that we want to carry out national adaptation plans, the health sector is quite organized in saying, okay, we need a protocol for that, we need a protocol for vulnerability and adaptation assessment, we know where to go to talk to countries and get the right people around the table, and we will implement a specific set of actions on the back of that. And so we have operational frameworks that the different regions have developed, and we're basically trying to bring together into a single package that describes the functions that health systems need to do to protect health from climate change. We've already published guidance on how the health sector can implement the national adaptation planning process. So I think we've been good on that. And then the final point I would say is that the actual amount of work has increased rapidly in the last 5 years since the resolution. At that time, there was almost no serious project work on health adaptation to climate change, and we now have several tens of millions of dollars from generous support from bilateral and multilateral donors in all WHO regions, with support from and strong engagement from and leadership from all of those WHO regions. So we now have a strong program that is showing how we can actually adapt to climate change. So I'll leave it at that, but I'm happy to add more information later.
Thank you very much, Diarmid. Have we been joined by Dr. Semenza? No, there's a blockage in the cyberspace for that. So what I would like to do now is shift into more of an open discussion, and I have a few questions for today. One of the things that goes without saying is that in public health we face very severe problems in the developed, in the developing world, in the present day in, day out. We have a tremendous burden of illness from non-communicable diseases that's growing around the world. We still have the scourge of communicable diseases in many parts of the developing world. And so there are emergencies that are already existing within the health sector that any kind of effort at health adaptation to climate change have to be able to be built into. So one of the principles that we look at in health adaptation to climate change is that adaptation measures should be, to the extent possible, integrated into existing programs, whether that's a program on protection of people with asthma or efforts at fighting malaria or other vector-borne diseases, and that those programs that are put into place should also be programs that have immediate benefits to address the impact of climate variability, current day climate variability on health. So they should be things that provide, they shouldn't be things where the payoff is decades in the future. They should be providing benefits since we have problems now. So one of the first questions that I wanted to ask each of our speakers was, of the adaptation initiatives that they know of, which ones would they call out as having the greatest short-term benefits for public health? And then also, to the extent that there are programs that are focusing a little bit more long-term, what would you say is one of the most effective or promising kinds of adaptation measures looking further out into the future? So, Dr. Bagayoko.
Okay, thank you, John. In fact, this is a very good discussion because it will tell us what is there on the ground. But to answer this question, I would like to make one good comment in my view, because climate change will not necessarily create new public health risks. It will exacerbate existing risks. So we have really to take that in consideration. So malaria is there, cholera is there, dengue fever is there. So it may change the landscape of these diseases or the intensity of their transmission. So any adaptation program we may want to develop may be seen as supplementary activities or intervention needed to address the problem. So having said so, what I will say here is, for the time being, we do not have operational adaptation program in the health sector on the ground in Africa. We have some prototypes, small-scale plans, which are just disease early warning systems, like malaria early warning system using climate services in selected countries. And to me, if we work and scale up these disease early warning systems, I think we will have a really good cost benefits. But for the time being, there is no large-scale adaptation program in the countries, in the health sector.
Thank you very much. Dr. Corvalan, for the Americas region?
Yes, thank you. John, that's an interesting question. There are many examples of activities in the region, and I think that, like, similar to the situation in Africa, there isn't in governments an institutionalized system for adaptation. And so adaptation occurs at the initiative of international agencies, at the initiative of some governments in some cases, and at the initiative of local individuals. And these, they all play out quite differently. And I have some examples. I don't know how much time do we have, but just to give you the example of Barbados, that we have a work in Barbados. I was recently there for a workshop, so we like to cite it a lot. And it's a country that is going to suffer, or already suffering from water scarcity because of climate change. And they had an interesting situation that they used to accumulate water at home in the past because there was no pipe water. And then there was breeding sites for Aedes aegypti and therefore dengue. And then this practice sort of stopped a little bit because there was more availability of piped water. But then water scarcity means that the water is not always regular. And then now, by government initiative, people have to have storage containers in all new homes. And then you have the situation that you have to ensure that you're not creating new breeding sites for dengue. We have an interesting example that I visited in Colombia, where they harvest rainwater, a very nice interagency project. The first rain washes the roof, goes to one container. The second water is for storage in the house, and it works really well. And that would be an interagency example. And then I can think of a very local example that has so far worked, but it will not work forever, which is the construction of houses in palaphites, in sticks, in the Amazon, particularly around Manaus and other cities. So what you have there is that the higher the river goes, and it goes pretty high, the higher you move your house. Now, what is the limit of that? Obviously, there's a limit. And we've been surpassing twice recently, in recent years, the maximum level of the Amazon River. So we have also unprecedented issues there. And then you have also the situation that we've had tremendous droughts. So the lowest level of the river have been registered. And that causes another problem, the accumulation of waves and other thing. It doesn't allow for transportation because transportation is done by water, etc. So this local adaptation that may work may have also a limit. Just to illustrate it with 3 examples. Thanks.
Thank you very much. Diarmid?
Thanks. I won't so much quote local examples, but again, a bit of perspective on where the priorities seem to be in terms of adaptation. In the short time that WHO has been heavily involved at the programmatic level, actually more on implementation, I think we've got quite, as I said, quite good in defining operational frameworks that cover all of the public health functions that you need to do. And the CDC example, they were some of the leaders in defining what those are. So it's important to have that overall to make clear there's a suite of things that you need to do. But one of the things that we've been picking up from the regions and the countries is that some parts of that agenda the health sector finds easier as entry points than others. And surveillance and response is something that they're comfortable with. It's part of the overall framework, it's part of what needs to be done. And it also lies within the realm of the health system. So they can do that almost on their own. And it's something they need to do anyway, as has been said. It increases resilience to current risks. So we're getting the push from the countries that first thing you do is surveillance. And although we push back a little bit to say you need a broader view than that, a longer term view than that, I think we're comfortable with that as a first entry point, because it will help you with your problem. It builds the evidence for the long term, and it's something that allows the health sector to really get engaged in something it knows something about. You'd also asked for long-term examples as well, and I think we are now implementing some projects in collaboration with the countries and the country and regional offices of WHO, which look at environmental determinants of health, specific environmental determinants of health, because in the long term we have to go further upstream. We can't just be reactive. To get better at predicting the disease outbreaks, we have to work on the conditions that allow those outbreaks to occur. So we have new programs, for example, supported by the UK government on water and sanitation and health, making that climate resilient, and also nutrition, now in partnership with other agencies supported by the Norwegian government. So I think in the long term, we have to push further back up the causal chain.
Thank you very much. So we've heard, I'll just kind of summarize what we heard there. There were a number of different types of examples. We know that one of the key adaptation steps is an early warning system, whether that's an early warning system for heat stress, an early warning system for an outbreak of airborne meningitis or malaria or dengue fever. And Dr. Semenza, who I had invited to join, has been working on something called the E3 network and the E3 geoportal, which was just released last week. Within unfortunately he was going to say what E3 stood for, but it's the European Environmental something network, which is a collection of tools and data sets to help with early warning of some vector-borne diseases and other infectious diseases in the European region. Those diseases are occurring now. We know that we're often late to address them, that if we wait for the surveillance, as you were saying, Diarmid, if we wait for the diseases to appear, then we've already missed the opportunity in many cases to prevent an epidemic from happening. And so that's one example where if we can get better at understanding the climate predictors in current terms of climate variability and be able to give a lead time in the identification of these kinds of diseases, that we can reduce the burden of illness and death from outbreaks and other kinds of events in the present day. And we've in fact seen this throughout the world with some of the heat early warning systems that have been developed over the past couple of decades. Dr. Corvalan mentioned some interventions that are more at the kind of housing level, that the fundamental essentials of health, shelter, clean water provisions, and the idea of making homes more resilient to floods. That's important both from a residential standpoint and protecting people's health from the protection of their homes. It's also a very big deal around the world in terms of the healthcare sector and ensuring that the healthcare sector itself is resilient to unprecedented extreme events and flooding. And of course, we have just seen in the United States a very devastating event a year ago, Superstorm Sandy, which had a very severe impact on the healthcare facilities in the New York area, 5 of them being shut down for months at a time. And so there are a lot of efforts now at looking at ways and quick interventions, the relocating of electricity supplies, for example, from basements to rooftops as a short-term solution for healthcare infrastructure. There are efforts like this going on both in the developed world and in the developing world to ensure more resilient structures in more rural and developing country settings. And of course, there are long-term solutions like we see, for example, in the Spalding Hospital that was just built on Boston Harbor, that was built with an eye to several feet of sea level rise. So it incorporates climate projections in its long-term plan. What I'd like to do is just pause now, and we've heard a lot of information about activities going on in different parts of the country and different kinds of ideas, and just see if the audience has any questions for any of the speakers about what's going on and the kind of concepts we've been presenting. Yes, sir.
Here you go. State your name and affiliation, please.
Hi, I'm Robin Stott. I chair something called the Climate and Health Council in the UK, which is an organisation trying to mobilise health professionals to protect us from climate change. And I'd like to thank all of you for what is obviously a very impressive programme of adaptation. And I'd like to try and ask you about the second question you've got down there, because it seems to me that that unless adaptation plays into mitigation, it's not in the middle term going to be helpful. And quite clearly, in terms of mitigation, in terms of reducing greenhouse gases, we have dismally failed. as a collective global lot. And what I would like to know is how the health sector can help. I'm getting a bit of song behind, which is lovely. How the health sector can help those countries who find it completely impossible to implement policies to radically reduce greenhouse gas emissions. And obviously, being the US pavilion, I have to point fingers, and the US is one of those. So how can the health sector enable us to make the radical reductions in greenhouse gases, which will only be the context which allows mitigation, adaptation to work?
Well, would you like to start? The finger is pointed, and I'll be happy to respond, but I'll give the other speakers a chance. Well, I mean, that's a wonderful question. We're focusing on adaptation today, but clearly we understand that adaptation is not the solution to the climate change problem, that we also have to be, that we're well behind on efforts to mitigate, and we're in a very serious state with that. And all sectors have to play a role. Now, when you ask what's the role of the health sector, as you know, in most countries, the health sector has a clinical part and a public health part. In the developed world, the clinical part is a huge part of our economy. It's a huge user of energy. In many cases, it has not been very focused on efficiency or its own greenhouse gas emissions. So I think that there is a role to start with for the health sector to play a leadership role in its own institutions, in advancing more efficient energy sources and being more careful about water, in building the buildings and managing those buildings in a way that, of course, primarily protects health and safety and patient safety, but also tries to achieve more sustainability goals. And in many cases, the approach that we're taking in our initiative as part of the President's Climate Action Plan is to integrate thinking about sustainability and greenhouse gas emissions from the health sector with more resilient infrastructure, in part because often the sustainability measures and the increased efficiency provides cost savings to a very expensive sector, and so those cost savings may help to also make the facilities more resilient, but also because sometimes sustainability and resilience can work at cross purposes, and you need to really be thinking about both at the same time. So that's part, and I think that if the health sector shows that leadership, that's a very powerful voice. If then hospital administrators and physicians in general get behind that. The second part of the question, though, is the information provided by the health researchers, by the public health professionals, and there are two important parts of that, and one that we've been working on for many years is to raise awareness of the health implications for climate change. One of the reasons that Dr. Chan phrased her statement the way she did is because in many parts of the discussion, the impacts on humans, on human health, on children's health, on the health of pregnant women, just isn't part of the discussion. It's about coastlines and other animals, and the human health implications are not mentioned. And so I think part of the role of the health sector is to raise awareness that this is an issue of human health and well-being. And then on the flip side, there's the message that we've been promoting in partnership, in great partnership around the world, that many of the things that need to be done for climate mitigation to reduce greenhouse gases, especially those things that either result in a reduced combustion of fossil fuels or an increase in the use of human energy for transportation and for getting around as opposed to fossil fuel energy, that all of those things have tremendous health benefits. And there's increasing analysis around the world of those health benefits showing that the monetary value of those health benefits in many cases are substantial enough to significantly offset the costs of the mitigation itself. So there's the two sides of kind of the information and messaging of the health sector in terms of both the risks to humans if we don't act on climate mitigation, but also the short-term and immediate benefits to human health that can accrue from taking steps to mitigate climate change.
Sorry, can I say that one of the thrust behind my question, why have we been so dismally ineffective in doing it? Because we've been doing all the stuff we've been saying, talking about the need to mitigate and adapt, talking about the things we've been doing, and nothing has happened in terms of the inexorable rise. And so, in a way, I'm asking our colleagues why the health sector, in their view, has been so dismally ineffective in getting our point across.
I don't have an easy answer to that except to point out that most great changes that have been brought from the health sector have taken many years and have to overcome many barriers, and we have been effective, but we're still in the process. You know, there's no easy answer for ineffectiveness in a change like that, but we'll recall that, you know, the information on cigarette smoking took many decades until effective interventions were made for cigarette smoking. Many things have taken many more decades than they really should have, and I guess this is in that category.
I have very little to add to that on the technical content. I think, given that we are, you know, talking about adaptation, I think one of the joins between the adaptation and the mitigation point is the one that John has raised about the role of the health sector itself. And I think it was great to hear those examples of the sort of greening of the health sector in the US. And it's something that we are looking at for developing countries as well, but with a different angle, basically. And to come back to the point from the audience, we also think it's important that health facilities should have the lowest environmental footprint possible. But if we're talking about African or Bangladeshi health clinics, the problem of climate change is not caused because Bangladeshi health clinics emit too much greenhouse gas emissions. So the primary role there is to make sure that those clinics function well, they have energy, they have water, they are resilient to climate, and then we will also try and ensure that they reduce their greenhouse gas emissions as well. But I think it's an important point that we can make this a development challenge as well. And and obviously the points about the short-term health co-benefits of mitigation are very important, particularly given the size of the health risks. So the recent evidence on air pollution is that indoor air pollution from solid fuels is about 3.5 million deaths a year, if you believe the recent Lancet studies. Outdoor air pollution over 3 million. That puts it right up in the front rank of global health risk factors. That's as big a killer pretty much as tobacco. So there is a big opportunity to promote the health benefits of cleaner energy and more more sustainable development paths. But so I think, again, to come back to the point of view of the questioner, I think we all have to ask ourselves that isn't enough. that we can make those arguments, and they are the right arguments to make, I think. But the point that John has made is that, you know, even so, even our best examples of public health programs have taken several decades, even for something as relatively obvious as tobacco. And I don't know if any of us have a very good answer to the question how we can work at the scale and the speed that we need to work at in order to make the climate change challenge. So I would say we're open to suggestions. We have the small things that we can do and that we're trying to do, but you know, great answers for transformational change are more than welcome.
Yes.
Can I add something, John?
Sure. That's okay. Carlos,
Yes.
and then we'll hear from Dr. Bagayoko.
Yeah, John, well, obviously we do some things on mitigation, although great of the focus of the work is adaptation. But given the session topic was adaptation, I suppose we were not mentioning it. But I want to mention two initiatives similar to what you were talking in the region. We used to have this, the safe hospitals or safe healthcare facilities to make hospitals resilient to disasters, which include all type of disasters, but also hydroclimatological disasters. But the latest initiative is to add the energy efficiency, because it's very easy once you're building a smart hospital also to make it energy efficient. So they are called smart healthcare facilities, and it's working interesting. Now, what I wanted to say is that we are working with countries to integrate the mitigation in their action plans. And in this case, I just want to make a brief comment about Brazil. I live in Brazil, and I supported the preparation of the health action plan for adaptation and mitigation to climate change. And this is a high-level plan, was launched by the President Dilma Rousseff in the presidential palace. But the important thing is that these sort of initiatives are linking both actions that address mitigation and adaptation. We're not looking at one or the other, we're looking at both.
Great. Thank you very much, Carlos. Dr. Bagayoko?
Yeah, just one short comment. Okay. Yes, I think the points made by colleagues are quite pertinent, and we are sure that the health sector should clean behind its door first before asking others to do so. And all the strategies proposed here are quite really pertinent. But one point is very important also. We have to acknowledge, as far as developing countries, and particularly Africa is concerned, the health sector was so far lagging behind the negotiation process. And we were misrepresented. So, and I think we are now working so that the health sector voice can be heard. And that's the only way through the in-country process that they can influence this. And so all the evidence we have can really have an impact.
Yes, thank you for mentioning that. I mean, we should praise WHO for helping to bring representatives of the health sector here to Warsaw to this meeting, and that's why we are here, is to do, you know, that step and to raise those voices. Now, I understand that we do have Dr. Semenza on the phone, and we only have a few minutes left. I wanted to just give him an opportunity to describe a little bit about what he's doing, and perhaps to take that question about his effort with the E3 network, and to describe how he sees it having short-term health benefits to the countries and the member states of the European Union.
Hey there, everybody. Jan Semenza here at the European CDC. Thanks for patching me in. John asked me to mention real quick here the work we've been doing with the European Environment and Epidemiology Network, E3 for short. We have set up a system where we're trying to collect environmental data to help us monitor environmental conditions and try to assess potential environmental precursors of epidemics or disease. And we have quite successfully used this novel surveillance system, or 21st century surveillance, to anticipate areas of malaria transmission in Greece, because you may know that in 2009, 10, and 11, there was active malaria vivax transmission in Greece, and we were able to identify the areas that were environmentally suitable for future transmission of malaria. We informed the public health community where that area was. They were successfully able to intervene by spraying and taking the proper public health measures, and the epidemic has stopped as a result. We have also used the E3 network for a number of other projects, such as West Nile fever outbreak in the southeastern part of Europe, where we have identified climatic conditions such as temperature deviations from baseline, and we are currently trying to develop that into an early warning system for West Nile. Similarly, tick-borne encephalitis in the southern part of Sweden, where we're using spring temperature as an early risk indicator for transmission later on in the fall of tick-borne encephalitis in the southern part of Sweden. We have also developed a system where we're using sea surface temperature and salinity levels for Vibrio, Vibrio parahelminthiacus, which is a non-cholera type of Vibrio that tends to bloom in very warm, non-salty seawater. And we have developed a system that's currently available on the E3 geoportal, where you can see where the risk for, or where the environmental conditions for Vibrio are suitable that could potentially pose a risk for populations that are immunocompromised to get wound infections that could potentially be fatal. So that real-time warning system is currently available on our E3 network also. So we have set up a number of systems like this, where we're trying to use environmental conditions as indications of future disease transmission, and we are working on more model systems like that to alert the public health community of where potential threats could emerge. I'd be happy to elaborate more, but maybe, John, you want to give me some indications of where you would like to steer the discussion.
Okay, thank you very much, John, for that additional information. I fear that my steering may have to be to draw the session to a close, because we have reached our time. If we could go to the last slide. But for those of you in the room, we can certainly continue the conversation. I'm sure the speakers will be happy to stay around. For those of you who are viewing over the live stream, I've placed some of the website URLs for our programs in the United States, our interagency climate change and health program, and my institute's global environmental health program, where if you're interested, you can find out how to contact us in that way, and I'll be happy to entertain any kind of questions that may come in through the internet. But for now, I'd like to thank our speakers for their wonderful presentations and discussion, and thank the audience, and we'll call it to a close.
Thank you also to our audience. Excuse me, our audience that joined us online. Up in a half an hour here, we have a great presentation from NASA called Eyes on the Earth, and it's in 3D. You get to wear these cool 3D glasses and see the orbits of satellites coming out at you, so I encourage you to stick around for that. We have one more presentation later today on climate adaptation plans at 6 o'clock, and then we have a whole schedule next week, so we hope to see you again.